It is up to you how often you bathe your baby. We do recommend that you do not need to bathe your baby every day at this time.
The umbilical cord will dry up and fall off within about 8 to 10 days. It will look black, and that's perfectly normal. If you notice that it is bleeding or smelly, you do need to contact your healthcare provider immediately. Otherwise, you do not need to do anything. It may get wet and you simply pat it dry.
You can take your baby's temperature under their arms. It is important that you do not take their temperature in their bum.
Your baby should see your doctor 24 to 48 hours after you leave the hospital for the first visit. You need to follow your manufacturer's instructions as to how to put the baby in, how to tighten the straps, and then check to make the strap is tight enough for the size and position of the baby.
It's important to dress your baby in an extra layer more than yourself. They are small and their temperature can decrease easily. If you're comfortable in the room temperature, then they will be comfortable as well.
You need to consider that all babies should be sleeping on their back in their own sleep space, whether it's a bassinet or a crib. There should be no pillows, comforters, bumper pads, toys, stuffed animals, or any other items in the crib with the baby. The baby only needs one, possibly light blanket on top, so long as you're dressing the baby appropriately. Your baby under the age of 6 months cannot wear sunscreen or bug spray. We suggest that you keep out of the direct sun, use a shade umbrella if you are outside, and use the bug netting if you're going to be outside in the stroller during the months of the summer.
It is unusual for babies to be sleeping through the night at this time. They should be waking up every 3 hours to feed.
You should not sleep with your baby. Your baby needs a separate sleep space, a crib, or a bassinet. If your baby begins to spit up, you can sit the baby up, roll the baby onto its side, and gently pat its back. Most of the time, spitting up for a baby is a normal process after a feed.
Skin to skin is a normal bonding process with your baby. As long as the baby's temperature is normal and you can stay awake, you can do skin to skin with the baby. If you're having a difficult time waking up your baby to feed, or if their skin is dry, their whites of their eyes are yellow, their skin is yellow, and there's poor feeding and output with their diapers, it's important to take them to their family doctor or emergency.
Your baby should have at least one dirty and one wet diaper on day 1. That should increase every day by 1 extra diaper. So on day 2, you should have 2 wet diapers and 2 dirty diapers. On day 3, you should have 3 and 3, all the way up to day 6, at which point your baby should produce 6 to 8 soaking wet diapers, and babies very often produce a dirty diaper with every change. In the beginning, your baby's poo looks black and sticky and oozy, and it's called meconium. Over the next 2 to 3 days, this transitions or changes into a greeny, browny, and then yellow poo, and at that point it will stay yellow and seedy looking without very much smell until you add solid foods at 6 months. You should use a barrier cream on your baby's bottom, particularly something like Vaseline. It's neutral and does not cause allergies, to protect it from the acidity of the baby's poo up until about 3 to 4 months of age.
Thank you for watching.
If you have any further questions, please ask your nurse before you are discharged home.